Well, data shows that Medicaid plays a more significant role in providing health coverage in rural communities than in metro areas. As Congress considers reduction in funding, well, many are wondering how it could impact small-town residents. And Leslie Dach with Protect Our Care joins us now for a closer look at the potential impact. Thank you so much for your time today, Leslie. Speak to the role that Medicaid plays in rural America and why it's so vital for these residents.
Well, 12 million rural Americans rely on Medicaid for their health care. That's the way they see the doctor. That's the way they get to go to a hospital when they need to. And that's at risk now because of these drastic cuts, all of which are designed to pay for a massive tax break for the richest amongst us and the largest corporations.
So let's talk about some of the main barriers that rural communities face in accessing health care overall.
Well, one of the issues, as you know, and everybody who lives in rural America knows, is that it's already often a very, very long drive to get the health care they need. And in an emergency, that could be life-threatening. And everybody in rural America, unfortunately, also knows that rural hospitals are basically struggling to hold on. They're closing. Many of them will close if Medicaid is taken away from them, because Medicaid is the major source of their income in many places. And that means that rural Americans will have to drive maybe 100 miles to see a doctor or to get into a hospital. And that isn't the way it should be.
No, not at all. And of course, as we mentioned, Congress is considering reductions in federal Medicaid funding. What impact could that have on rural health care?
Well, the first thing it's going to do is to just cut people, end the ability to use Medicaid to get coverage and to see a doctor. So, there are 12 million people in rural America who rely on Medicaid, but what we don't know the actual numbers for rural America, but we know, according to bipartisan and nonpartisan number crunchers, that close to 10 million Americans are likely to lose their coverage through Medicaid if these cuts go through.
And that is such a dire situation. So any other options for rural residents, or would they just be left without access to good health care?
They will be left out. There's just nowhere else to go. And, Medicaid is already the most efficient healthcare system in the United States. Only 2% goes to administrative costs. It is far more efficient than any private insurance in the country.
So interesting. We've got to stay on top of this. That's Protect Our Care CEO Leslie Dach. Appreciate your time today.